Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, September 28, 2020. Happy Monday. I hope everyone's having a wonderful week wherever you are. So what's going on with COVID? We had 861 new cases in Oklahoma. We're getting into the upper 80,000s. Our death rate is stable over the last 24 hours. The national picture is about 37,000 new cases reported and about 361 new deaths. Some of the places where it's picking up nationally, Illinois, Wisconsin, California, and Texas are leading with the most number of cases. The notable thing when I'm looking at the numbers, I look at the statistics and wonder about what it all means. The notable thing is you look at New York, and they had about 490,000 cases, and they had 36,000 deaths. And New Jersey had about 200,000 and 16,000 deaths. They have the highest death rate in the country. And, it gets back to, California has 800,000 cases and only 15,000 deaths. And it all gets back to this, and I'm not being political, I'm just being observational, but God, everyone gets mad if I speak the reality of decision making, is that whatever New York did, and it was probably the sending the patients back to the nursing homes when they were still infectious, and again, that was in the rush to get people out of the hospital, really backfired and killed, and the same thing in New Jersey, really killed a disproportionate number of people by putting the virus back into nursing homes en masse. So it's an interesting concept. And now let's compare what's going on currently with schools, because I've talked about schools should be reopened. It was safe. Some people disagreed. Nancy Pelosi would put me in jail because that's how she's acted towards people who've said that. And it's worth noting that because it's all lies. And we have to call people out for lying, just like I called out Fauci, and I'm going to really call out Redfield tonight. The whole thing is, now schools have been open a month and a half. Is there been some big pulse of cases within K through 12, where massive number of kids have gotten sick, they've gone to the hospital, there's been deaths? The answer is no. There's no reported deaths associated with school opening thus far. There's no reported severe illnesses reported thus far, because I've been following it, and I looked again today. The actual rates, and there's a national dashboard now that's out of Brown University, and they don't have all the data. They have about 200,000 students across 47 states, but I think it's still interesting data. The overall rate per 100,000 students is 16 infections. 16, okay? That's pretty low. If they're at a full capacity school going every day, it's 24 per 100,000, and hybrid is 14 per 100,000, where they're coming and going. Some days they go, some days they don't. The interesting thing, though, about these statistics is in these schools, only 77 or 80 of the 200, it's important to underline, though, that just 77 of the 230 cases were confirmed by coronavirus testing. And again, a lot of it's a little cray-cray when we're seeing reports that they haven't even been confirmed. Now, I would promise you way more kids have gotten infected than that. But the point is, they're not getting sick. They're not getting sick. And schools need to be open so they can have normalization. Since I take care of teenagers, both boys and girls, one of the central things that they note for emotional distress is the schools not being open. Every single one of them. It's causing them emotional distress. And that's a bummer, because schools should be open. Now let's move to teachers. Now, there was an earlier report in mid-September, which evaporated now because it was baloney, that 7 teachers had died since schools opened. Yes, 7 teachers had died since school opened. 6 of them, or 5 of them, got COVID and were infected with COVID before school even started, or they had any contact with students. So that was spurious, and again, just alarmist, picked up by all the mainstream media. One of them died of a heart attack, but then a postmortem was tested for COVID and was positive, but he still got listed as a COVID death. One younger teacher who was 28 was diagnosed with COVID 4 days after school opened and got symptomatic. That would be the absolute absolute earliest. None of the students in that case were positive, and they could not trace any source to the infection, and no one else in the school no one else has gotten infected from that school during that phase. So again, the teachers and the overall teacher rate is remaining somewhere in the range of 443 teachers have been theoretically infected, if I have the number right, or 554 is the total. But more than 2/3 of those cases were not confirmed by testing. They just got listed as suspected COVID or included as COVID because they had cough, cold, and congestion and stayed home, but they never got tested. So again, the numbers are very, very low. There's no big pulse of death for the teachers or the students. And again, that's what the science has already said. So then let's segue, because it's about data. It's always about data and not what the media is saying. Let's segue to Robert Redfield, the head of the CDC, who, let's again go through the litany of errors, who didn't acknowledge that COVID was coming, even when, and that's back in December and January as it was all coming out, persisted through January. Then, as the head of the CDC, elected not to use the world's best swab, which is the World Health Organization, led the charge to develop an experimental swab as a data collection tool on all COVID type or corona type viruses. At the same time, it failed and left us with no testing capability in the country essentially through early March, which is the greatest single defeat we had, because if you can't test and can't diagnose, you can't trace and do contact isolation and all the stuff we needed to be doing in the earliest part. Then they lied about it to everyone. And then he lied about mask wearing being not useful. And then Fauci eventually admitted they were all lying on purpose, and it was a group decision essentially because they wanted to say PPE for hospital workers. The Center for Disease Control had never encouraged people to order any PPE, a total failure. Then we've had all the wishy-washy on how is it transmitted, respiratory, non-respiratory, back and forth on masks, back and forth on who should get tested. I mean, basically, he's I don't even know what the right word would be to describe his complete failure in leadership. And so the mainstream news thing today was him casting stones at Dr. Atlas, the new Trump advisor. And whether or not the Trump advisor is good or bad, Robert Redfield should not be criticizing anyone, because he's going to go down in history next to Fauci as the single greatest failure in leadership in public health history. And why is he criticizing Atlas? Atlas is being criticized because schools needed to be reopened. He's criticizing Atlas because we need to do targeted protection. Yes, we do. Why won't we do targeted protection? Let's look at people at risk. Let's say, hey, if you're at risk, you really got to pay attention. Is there any messaging from the CDC on that? No, there's none. Come on. It just drives me nuts that everyone's so busy criticizing everyone else that it avoids them having to do their jobs. And so it's again left to us. And so, as I pointed out, our NIH leader in this effort is Dr. Fauci, and he did point out that vitamin D is positive for you and protective. So, hey, Dr. Fauci said it, so it must be true, but it is actually true. Likewise, I think he's eventually going to say zinc's very effective. I think he's probably going to say, or is going to have a role in protection. But the bottom line with vitamins is they rev up your immune system and give you the ability to fight the virus better. They give the ability to not get as overly inflamed, because that's what causes the problems. The inflammation then leads to blood clots and all kinds of problems and respiratory failure. So that's the focus tonight. It's just, hey, there needs to be some truth. And so for the people who are really, really conservative and hate Trump and all that, this isn't about being pro-Trump. It's about the baloney of people criticizing other people who are scientifically correct. These people are not scientifically correct who are leading us. And so, yes, someone has to call it out and say, yeah, no, we can open the schools. We can do some things to make society better in the confines of safety. And again, I'm always going to be mask, sanitizer, social distance when you can, avoid eating inside when you can, don't go to bars on the inside, and don't go to big group happenings. I think personally going to a high school football game and being in the stands is one of the silliest things you can do. You may get away with it 10 times, and the 11th time, if there's that many games in a season, you could catch COVID. And that's the point. You're outside, it's less risky. But again, it's kind of silly at this point. So that's the news for the day. Let's focus on medicine, and let's focus on science and move forward. So thank you very much. And if you have any questions, please send them, because we'll try to go through questions tomorrow night.